This is a transducer probe for an abdominal ultrasound scan. And this wand or probe is for a vaginal ultrasound scan, sometimes called transvaginal ultrasound scan. My amazing sonography colleagues are the ones that I will refer to have an investigation of your tummy area to find out what further information I need based on the symptoms that you come and see me with. The abdominal ultrasound scan allows us to look at the organs, and what we try and say to people is go with a full bladder, because that gives us an idea of what the bowel, the liver, the spleen, the pancreas, and also the uterus from the top and the ovaries can look like, but it doesn't always give us the greatest clarity. Therefore, to get more detail, we do a transvaginal ultrasound scan using this, sometimes like a magic wand that goes into the vagina, and that gives us a more specific look at the female pelvic organs, so the uterus, the cervix, the ovaries, the fallopian tube. And it's also considered the gold standard for early pregnancy detection. Usually if you're pregnant sort of between 5 to 12 weeks, we can pick it up much in greater detail, as well as look for more specific gynecological conditions like fibroids, cysts in the ovaries, or cysts anywhere around the uterus, or look for causes of abnormal bleeding such as PCOS or adenomyosis or endometriosis. So women's health trained sonographers or gynecologists who are trained to do sonography can pick up adenomyosis and endometriosis on a transvaginal ultrasound scan. Sometimes even on the best transvaginal or abdominal ultrasound scan, or both of them are done together, we might not be able to see all the things that we wanted to look at. Therefore, we might have to do some other investigations like a CT or an MRI. That's why some diagnoses can't be excluded or ruled in just because of an ultrasound scan. We always have to follow the patient's symptoms. So keep tracking your symptoms. The scan is just part of the jigsaw piece that helps us to piece things together. But if you're still having symptoms such as heavy bleeding or painful bleeding or abdominal pain, and the scan came back as, say, normal, we can't exclude endometriosis and adenomyosis. So therefore, we might have to do further investigations. I hope that's been helpful.